Good morning. Well, let me say it's good afternoon. And welcome to the 68th Flint Community Webinar on Coronavirus. And we're so excited that you joined us today. I want to appreciate all of our panelists that have joined us. The Healthy Flint Research Coordinating Center, which is a community academic partnership, has stood this webinar up to bring you relevant and credible information from our community leaders. The webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm excited to be your moderator again today as a co-director of the community core of the Healthy Flint Research Coordinating Center. We could not do this, however, if we didn't have amazing community partners who have worked with us throughout this 68 weeks to bring this relevant information to you. Remembering now in March of 2020, we were given a mandate by our governor and the issues that we saw happening across the world, and particularly even from our federal bodies, that the CDC was saying we needed to be careful. We need to shut things down to shut off this coronavirus. And we ask our community partners to come and help us to understand how we here in Flint, Genesee County, would deal with this issue. So again, let me appreciate those that have helped us to make this information available to you. And I see so many of our partners here with us today. We want to get started out because we always are hearing what's happening and wanting to know what's coming out of the governor's office. And I was just wanting to make sure that our key person today is here. And so we're going to talk to you today about what's coming out of the governor's office, but there are a couple of other things that are really critical. And one of those is this Delta variant and what the implications of that is within our community. As we look at what's happening from the state giving us some freedom, what do those state mandates mean to Genesee County? And of course, as we continue to open, how are we in this holiday weekend? How are we going to be sure that we remain safe? And of course, we'll get an update from our public health policy team. And so I want to just bring Gary Jones, who is a representative from the state, right out of the governor's office. And Gary, we're happy that you're a part of our community to give us the updates directly from the governor's office. So Gary, help us to understand what's happening on the landscape from the state.
Yes, thank you, Yvonne, and good afternoon, everyone. There is a lot going on. I'll try to be as brief as I possibly can. So the recent response to Michigan's new My Shot to Win sweepstakes has been amazing. Within 24 hours after the governor announced the creation of the My Shot to Win sweepstakes, a lottery-style raffle that gives vaccinated Michiganders a chance to win more than $5 million in cash and a combined total of nearly $500,000 in college scholarships. Entries began coming in real fast. As of today, the My Shot to Win sweepstakes received 464,698 applicants within a day, almost 500,000 people for the grand prizes. This also includes 23,978 young Michiganders who signed up for the scholarship program. In addition, news coverage of the governor's announcement of the sweepstakes also generated publicity about both the giveaway and the importance of getting the COVID-19 vaccination. The sweepstakes began yesterday and will end on August 3rd, 2021. Eligibility criteria for each of the drawings is at www.myshottowin.com. That's MI-SHOT, SHOTTOWIN, myshottowin.com. Also recently, the governor signed bills to ensure access to emergency insulin supply at a cost affordable to all Michiganders. The bills allow pharmacists to dispense an emergency supply of insulin to individuals with an expired but otherwise valid prescription issued within the last 12 months. They also require insurance to cover an emergency supply of insulin when dispensed under certain circumstances. The governor also recently signed bills to allow the Michigan Department of Treasury to use overall scholastic achievement to determine eligibility for competitive college scholarships instead of relying just solely on the ACT and the SAT. These bills acknowledge the challenges that many students have had in accessing standardized tests during the COVID-19 pandemic. The governor also recently released an acknowledgement of the school aid fund budget approved by the Michigan legislature. She urges the legislature to continue working together to approve the remaining budget bills. While the legislature finalized the school aid budget, the rest of the budget remains incomplete. So the governor proposed her original budget proposal back in February of this year, 2021, which centered on equitably growing the state's economy by expanding skills training and childcare for families, rebuilding the state's crumbling bridges and water infrastructure, and helping small businesses recover from the pandemic. The governor is encouraged by the legislature's move and looks forward to passing a full budget and appropriating the remaining federal stimulus dollars with Michigan's unprecedented $3.5 billion surplus to make a real difference in people's lives right now, today. Earlier this week, we had a virtual town hall series where we discussed high quality healthcare, mental health, and reducing health disparities with leadership from Henry Ford Health System, the Coronavirus Task Force on Racial Disparities, the Autism Alliance of Michigan, as well as the Autism Council. If you would like to see it again, or in case you missed it altogether, email me directly, and my contact information is on the screen. Email me at jonesg9@michigan.gov. We all have a role to play in this, where we can push for a budget that includes significant investments to improve health outcomes for all Michiganders. And lastly, Governor Whitmer came to Flint earlier this week on the campus of Mott Community College. She reiterated her call on the legislature to join her in expanding the Futures for Frontliners Scholarship Program to include frontline workers who serve the public during the second wave of the pandemic. So that was between November 1st of last year up until January 31st of this year. This would allow 22,000 additional frontline workers to be eligible to apply for a scholarship to attain either a technical certificate or an associate degree at one of Michigan's community colleges. Special thanks to Dr. Beverly Walker Graffia, the president of Mott Community College, as well as the staff over there at Mott for being such gracious hosts. And lastly, always like to plug the catch-all websites, michigan.gov/COVID vaccine and michigan.gov/coronavirus. Still the best websites to keep up with everything that's happening.
Thank you so much, Gary, and excited that the governor made her way here to Flint. That's been a great thing. And so we're still getting a lot of exposure. And so you mentioned that second wave, and Lord knows we don't want a third wave. So the push for individuals understanding why getting the vaccines is so important is part of the reason why we're here today. We're getting ready for the holiday. And so we're going to ask our panelists. I'm going to ask, you can stay with us, Gary, but I see Dr. Hacker, Dr. Reynolds, Dr. Wolford for the roundtable, because I've got a couple questions for all of you based upon this information that Brother Gary has shared here with us, this exciting My Shot to Win vaccine sweepstakes. Is that going to really get us where we need to be, especially over this holiday weekend?
Well, if you're asking me, it'll get us there one step at a time. You know, we did the easy part in the previous months. That was the sprint. As I've said before, now we're running middle distance to cross country. And it's going to be 1 or 2 shots at a time. So anything that contributes to this is fine. And I just want to know from Brother Jones if I can sign up for the lottery since I got my shots. And I'll end with that.
All right. I knew that question was coming, so it's back to
Of course, absolutely, absolutely. The part too, I mean, and you know, some people have talked about, well, you know, didn't Ohio do this? The really important thing that I like to emphasize, and I make sure that our education community partners know, is the scholarship portion, of this too as well. It's about, I think I said earlier, about $500,000 in college scholarships that are also available, with signing up for the sweepstakes. So yes, Dr. Reynolds, to your point, but I think you got enough education. I don't think you need no more scholarships.
Well, I won the lottery by just getting my shot as quickly as I can for my age group, and I hope others will follow. And I'll let others speak, because then I do want to talk about child cases across the nation and in Michigan.
So, Dr. Hacker, and I'm going to ask you and Dr. Wolford to talk about this with this holiday season. Well, not holiday season. July 4th is here, and everybody's ready to get out and about. The state mandates are no longer there. But what about this Delta variant? How concerned should we be about that?
Do you have a preference who goes first?
Dr. Hacker, you can go first.
It's very concerning. It is much more transmissible than the one that is the most common one, which is the Alpha variant. And that was more transmissible than the original wild type variant. The concern of this is it's about 50% again. So total about, from the kind we started with the wild type a year ago, it's probably estimated about 75 to 80% more transmissible. As an example, which I thought was very concerning, they picked up on an airport security camera 2 people passing on their way to their planes, but just passing. So seconds, it was seconds. And they were then able to identify the genetic types of both of those people. And that was their only interaction. And those were like completely a match. So it was timing wise, and the genetics of it show that it can be transmitted in that short of a time. And the good news is that it is showing that the variants, particularly the Delta variant, the vaccines that we have, the one that's the 2-shot vaccines, are very effective against it. But the concern is for the people who are unvaccinated or partially vaccinated, that this is something that's easy to get, and it is still, they're still looking at how much more significantly dangerous it is. Like, does it cause significant higher numbers of hospitalization, and what exactly it is? They think it does cause more based on some of the studies out of England, but it's about 10% now of what is circulating in the United States for the last 2 weeks. So it's going up rapidly, and it is something that is very, very concerning to people who are unvaccinated.
So we really want to just make sure that we're going to talk about this a little bit later, the opportunities for getting vaccinated. But even though we're in the holiday, we still want people to follow those protocols.
Correct.
So I had a little conversation with Dr. Wolford earlier, because she did this great thing on vitamin D a little while ago. And in conversations as well with you, Dr. Hacker, I did my own little health check and asked my physician, because I was made aware that sometimes physicians don't ask you about your vitamin D on a regular basis. Found out mine was extremely low, and I was a little bit embarrassed because I didn't even get a 10. My vitamin D level was lower than a 10. And so I talked with you, and I talked to Dr. Wolford, which is why I'm so appreciative of the webinars for me personally, because it allows us an opportunity to get information. The fact that we need vitamin D to help us with these variants and with the whole, because our body is still our best defense. So I want to just shift over here and ask Dr. Wolford if she'd give us a little bit of insights on, even with the Delta variant, I'm going to stay there, how important is us having this understanding about our vitamin D levels?
So I think, thank you so much, Yvonne. I think it's really important for us to think through this whole time, moving forward, now and moving forward, that our bodies are always going to be our best defense, right? And I put this little picture up behind me, which of a family tree. I want you to think of it as a family tree. We started off with COVID-19, then we got the Alpha variant, now we have the Delta variant. It's not going to stop there. we are going to have more and more variants. And each time it carries something from the previous version, and then it gets something else that makes it stronger. And the best way to protect ourselves is to have that Swiss cheese approach to protection. So we need to get the vaccines because that will keep us protected to some extent. We need to keep our distance. We need to wash our hands. We need to be wise about groups. We need to do all of that. And then we need to keep our bodies healthy. And so one of the things that we think makes a difference is having vitamin D. Now, the important thing about that is we don't know whether it really matters if you get vitamin D when you're actually sick and in the hospital. So they're doing studies on that. And it might be that you just have to have a good level going into the illness. So why wait till you're sick to try everything to fight off this illness? Why not try to prevent it by being as healthy as possible, getting that vitamin D? And let's face it, even if it doesn't actually pan out that it makes a huge difference in COVID-19, though we do think it helps our immune system in general, it certainly helps your health overall. And I'm sure if we asked Yvonne how you feel now that your vitamin D level is improving, I'm sure it's night and day.
Well, if I get any more energy than what I have now, I don't know what everybody's going to do with me, but it's working. So Dr. Hacker, now in this conversation, we recognize that even though people are, that vitamin D is one thing. So you had another comment that you wanted to make with respect to vitamin D. Dr. Hacker.
Yeah, so I put it in the chat because, and it's not to just play word games, but I do think that as critical as vitamin D is, and I am its biggest fan. It's not only a vitamin, but it's also a hormone. It affects so many different things. It reduces respiratory infections in general about 30% in people who have a high enough level. It's still only 30%, whereas the vaccines for COVID are 95% effective. And these are the most effective ways. I urge everyone to make sure that their vitamin D level is high enough for so many different reasons. It also is a prevention for some of the kinds of cancers out there. But it's still, it prevents, it's an aid, but the vaccines, 2 doses of the mRNA vaccines really do offer the fullest protection that we have available.
So right there, we have, go ahead, Dr. Wilford.
I was going to say, it's really important to note that about the vaccine. It actually gives us more protection, it appears, than even having had COVID. So if you had COVID and you have some antibodies, that can help you, but it appears that the vaccine protects you even more against the variants than did actually even having had COVID-19.
Okay, so here's a question in the queue. Many are testing positive for COVID, although they have had both vaccines. So what are the repercussions of this? I mean, so we're telling people, we're encouraging people, get the vaccines, and yet there are people who are still getting COVID.
So the really important thing to note is that no vaccine is 100%, but what we want from the vaccine is that it prevents us from severe disease. It prevents us from hospitalization. It prevents us from death, right? And the vaccines do that very, very well. So yes, as we see more of the variants, we will have more people who have been vaccinated who may test positive. But what we see at the moment is that even if one tests positive, you are much less likely to have a severe course of the illness, to end up in hospital, or die as a result of these variants.
And I strongly support that. When you look at the number of people who are hospitalized with COVID, over 99% of them have not been vaccinated or not fully vaccinated. And that's remarkable. It is so effective.
And we should be clear, you must be fully vaccinated. You must have the 2 vaccinations for the mRNAs. And then even if you have the J&J, you still have to wait 2 weeks after you've completed the course. So in certain situations, you still need to mask up, wash your hands, maintain physical distancing, avoid crowds. And so many people who have had the vaccination had a contact just before they had the vaccine, during or between the two shots, or they rushed out that evening after they're fully vaccinated and they get infected. And so people will say, well, the vaccine didn't work. No, perhaps you didn't follow the instructions. And yes, there still is that 5%, around 5% risk of breakthrough, but you have to follow the instructions. So you get fully vaccinated. If you get the J&J, you wait 2 weeks after the vaccine. If you get the mRNA vaccines, both of them, you wait 2 weeks after you got your second one. So please keep this in mind. It doesn't mean we run out there and be reckless. And I'll talk to you about the holidays. You know, when you are in a crowd of people and you don't know their vaccination status, especially if you have some crazy cousins, nephews, aunts, and uncles, you may want to wear your mask. And there's another reason, and the pediatrician in me comes out there. If kids under 12 are still required to wear masks, the best example we as responsible adults can provide is wear a mask with them. That will reinforce the behavior, and it will also make us walk out the house with a mask to put on for ourselves and the people around us. So think before you act.
So a quick summary. The Delta variant is out and about, and it is more easily transmittable. Just make sure I got it right. So the vaccinations help reduce the risk of added complications if we do get exposed and we do get the virus. Is that correct?
That's correct. And it's important to note that that Delta variant, it's doubling in frequency like every 2 weeks. I mean, it's just getting more and more common within our communities. So we're getting an increased risk of coming in contact with it. And if we do, it's much easier that COVID was much more transmissible than the flu. And now every generation of these mutations are getting more and more transmissible and potentially more and more severe. So we really want to get the vaccine and practice all the mitigation habits that we now know very well so that we can protect ourselves from these new mutations.
And I would like to just share a personal thing that Dr. Reynolds' passion has inspired in me is I go into, if I'm in a store and I'm dangling my mask on my finger, with my purse kind of thing. If I am near a child, I put the mask on, and it's not because I think I'm going to give them the, COVID, because I know I don't have it. I've been fully vaccinated, and I also am quite, careful with my exposures, but I put it on just for the parents' peace of mind, so that they don't have to pull their child away from that unmasked person. So I do. It really changed my personal, experience in what I do, but I'm doing it more for the peace of mind of the parents than my concern that I am going to transmit. But they don't know if I'm someone who's vaccinated or if I'm not. So I put it on, and then they don't pull the child away out of my line of sight.
I actually just answered a question that was in the queue. Is how do we protect our children that are younger than 12 years old and are not able to get the vaccines? And so all of this works together. The idea that we do what we can do personally. If there's some things that we can do to improve our health, like increase our own personal responsibility, get checked out and make sure there's something that you need to boost up in your immune system, like vitamin D, you do that, but also consider the value of making that decision for yourself as to whether or not the vaccine is something that you want to do also to improve not only your personal health and well-being, but the health and well-being of others in the community. Dr. Reynolds, I want to just, before I come to you, because you had something else you want to share, but I know, Brother Clarence, I saw some commercials this morning about what's happening over in Hamilton, and we're going to talk about vaccine availability, but I know you're making special efforts at Hamilton Community Health Work for people to get vaccinated.
Yes, Yvonne, we are making special effort, encouraging people as best we can to get vaccinated. I mean, that's our one defense that we know works, and people should take advantage of the vaccinations. We're doing vaccinations 3 times a week at our mobile sites. That is at our 3 locations: our North Point location on Pearson and Clio Road, our main location there at 2900 North Saginaw Street, and at the Burton Fire Department. Those 3 locations, Monday, Wednesday, and Friday, you can get your vaccination just by driving through. So it's very quick and easy. We also are providing vaccinations at our clinics. You can get vaccinated at any of our clinics, really anytime. So again, we're encouraging people. We recently did get the Pfizer vaccine, and we're focusing on the 12-year-olds up to the 18-year-olds. And we are doing the social media and getting the word out through commercials, and just encouraging people to get vaccinated with the hope that we can address some of those issues Dr. Wolford talked about, making sure people have the defense they need and can protect themselves and their families.
Thank you so much, Clarence. All right, back to you, Dr. Reynolds. I'm going to come back to you in a little bit as we have an opportunity to talk more with you a little bit later in the session, so you can give us that added information. But I want to thank our panel right now for all the information that you shared. There's a couple more additional questions we're going to get answered, but we'll do that when we talk one-on-one to our panelists today. So thank you for your participation in the roundtable. So Dr. Hackett, I want you to stay with me though, because we're in July. And you came to Flint in January and hit the ground running. I want to take this opportunity to personally thank you for the efforts that you have made to make sure that the health department was responsive to the needs of the community. So if you could join me again real quickly, I wanted to just follow up on one of the questions that was asked earlier. But just want to just ask you to just give us a little bit of insights on this question that's come up about opening up our state again, and the fact that as a health officer, many of the state mandates then left responsibility to the local units of government, particularly in the area of public health, to make decisions for our county. So can you tell us a little bit about what your recommendations are for Genesee County as we open up our state, our community?
Absolutely. So we are looking very carefully, like on a daily basis, if there's changes in our case rate. So our numbers are low. It went from, it depends, it's numbers are so low right now that you can look at different pieces of the week and it doesn't even look like it's, it can look a little more dramatic, but in reality, 2 weeks ago, we had about 2.8 cases a day, so less than 3 cases a day in the whole county. And then on Wednesday, when we did the community call, it was under 2, it was about 1.8, so less than 2 cases per day. Right now, I asked what the last, if you look at 7 days, it's 2.5. And these are, remember how many we were having. We were hitting 300 cases a day, just 2 months ago. And so when you look at these cases that are so small, the number is so small, one large family, which did occur, can change those rates. So I'm trying to look at it both in the perspective of catching any kind of new variant activity in our county very early, but also recognizing that, a family of 5 or a family of 6 or 7 can really bump the average up when you're talking about less than 10 cases a week for the whole county. So looking at that though, every single day, because that's what they have found. When the Delta variant starts to hit a community, you see the sharp increase in case rates going up. And it is concerning to me that in the United States, the Delta variant now is up to 10%. However, in our state, we have only had 25 in the whole state right now. And I have been told, I have not confirmed it, that some of those are actually cases that they're not residents in our state. So there's probably less than 25 right now. And so we're looking at that. There has not been one reported yet in Genesee County. However, there's like 1 or 2 cases in most of the counties around us. And so we just have to assume that it's here. That being said, the other piece of it is the mask use. And we have talked about what and who is really being protected by the masks. And it's the unvaccinated. And, you know, we have now we've gotten to over 50% now of people who've received the first dose. And the reassuring thing is most people, the vast majority, well over 95% of the people who get their first dose do get their second dose. So it's somewhere around 41 who've been gotten the completed series and 2 weeks less, or 2 weeks after that. But we would anticipate in another 3 weeks, all those 50 people, 50% will be fully vaccinated. And so we're looking at that and trying to weigh the balance of, try to make sure that people who are still waiting for questions can get those questions answered. And also people who are waiting for convenience can have a very convenient way of getting this vaccine. And really that's the message we have to get, is that please let us know what it is that would help you decide you do want to get the vaccine, what questions are standing in your way, and what other barriers may be standing in your way. If it's a question of work schedules, we'll make sure that we can either accommodate you ourselves here at the health department, or give you, name of one of our community partners who can do that as well.
Thank you, Dr. Hackett. When you talked about what some of the barriers might be, one of the questions that was asked as an extension, this is an extension of a question that was asked earlier about our children. There have been some questions about the blood clots for children. So basically a question that parents have is they've got to make a decision as to whether or not they get their children vaccinated. And if there's any possibility of blood clot, or we talked about the inflammation around the hearts, how do we respond to those questions for parents?
So I have a lot of sympathy with those questions in particular. The viral illness in end of April during final exams, took him on a plane, long plane ride, and then on the way back, he started having chest pain. And, I was afraid it was a pulmonary embolism, a blood clot that had gone, from somewhere else in his body into his heart or lungs, and that he was, having that as the side effect, even though he was young and incredibly healthy. And so when we took him to the hospital right after the plane ride, much to my surprise, he had this myocarditis. So there are so many viruses that can do it. They did blood cultures, they did it. They never knew what virus caused it, but that's what had happened. And he was hospitalized in the ICU for 6 days as a 19-year-old with myocarditis. He has had full recovery, which is amazing, but he spent a year on, 4 or 5 heart medications. So it happens a lot. It's, there's with viruses of all different kinds. And that's the point of this, is that it happens with COVID as a disease. If your child gets COVID, they are much more likely to get that myocarditis from COVID disease than they are to get it from the vaccine. And it's something that, I don't go out and tell everyone. Now I've told, 53 people about my son's illness, but I don't tell everyone. So people don't hear about that, that he had this from a just general virus that he had gotten. And you don't hear people talking about it, but in reality, the risk of getting it from the vaccine is just minuscule compared to getting blood clots or heart disease, even in children. And I'll defer to Dr. Reynolds for that, but even in children, it's still very, very small compared to actually getting the infection and having those same problems.
Thank you, Dr. Hackett. And I know there are more and more questions, and you've told 53, but you may have told hundreds of others too, because others will be watching the webinar following this. But we appreciate your openness about this, because we're all human, and all of us are experiencing various things. So those kinds of expressions and testimonials help others to figure out how they can make the best decisions for themselves and their families. Again, you've done a lot in our community in these few weeks, months that you've been here, and we appreciate that. And you've got a wonderful young lady that's been working along with you, Sherelle, who's going to give us the updates from the health department now. So thank you so much, Dr. Hacker.
Thank you. It's just a pleasure to meet everybody here.
Okay. Sherelle, tell us, you're not out at an event today, but there are events going on.
There are events happening, and today we are at Our Lady of Guadalupe until 2 p.m. So if you haven't gotten your vaccine, please get there. And I do want to start off by saying let's continue to beat COVID. You know, we've been doing a great job getting our residents vaccinated. As of 10 a.m. today, year to date, we've had about 33,639 cases of COVID within Genesee County. But for the past 7 days, our average of cases has been about 2.5 cases a day. So we're seeing big changes. We're averaging less than 1 death a day, and our positivity rate is very awesome right now. It's down to 0.8% for the last 7 days. And I just want to see everyone continue to get their vaccines. In Genesee County, we've administered about 315,000 or more vaccine first doses. About 19.9% of our 12 through 15-year-olds have received at least their first dose. And for our adults, about 51.5% have received their first dose, so 16 and older, and together combined, fully receiving both doses of vaccine or the one J&J, we're at 42.7% of residents in Genesee County. So our efforts continue there, and we encourage you to continue coming out to our clinics to get your vaccine, because we are offering them most days of the week. Next slide, please. So on the screen, you'll see some of our upcoming clinics and times. As I said, today we are at Our Lady of Guadalupe, where we have Moderna and Pfizer both available. On Tuesday next week, we're going to be at Our Lady of Guadalupe. We'll no longer be there on Fridays. We'll be there Tuesdays now. And we'll have Moderna and Pfizer at that clinic. Wednesday, we'll be at our Central Church of the Nazarene from 9 to 12 doing Pfizer and Johnson & Johnson. And Thursday, we'll be at Shiloh Baptist Missionary Church, where you can get your first and second dose of Moderna. That one is a little later for those who can't make it to an early in the day clinic. And then we are bringing the vaccine where you are from Thursday through Saturday. We'll be at McDonald's on Miller Road. So if you happen to stop by and get some food and you haven't been vaccinated, there's your opportunity to get a vaccine. We'll have both Pfizer and Johnson & Johnson available at those McDonald's clinics. And it is still very important that we continue getting tested. We don't have that Delta variant in Genesee County, so we want to make sure that we don't have it. So continue getting tested. We have the same sites available through our local churches: Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. And as you know, you can go to your local Rite Aid or Walgreens, or visit Hamilton Community Health Network or Genesee Community Health Center to get your COVID-19 test. And lastly, I would like to say that we have come a long way. In the beginning, we had to schedule appointments to get the vaccine. There were certain criteria you had to meet to get it. Now everyone can get their vaccine who was 12 and older. You don't have to schedule an appointment or register or anything, just walk in. So we're providing you with those lists of locations weekly. Just choose one and come out and get your vaccine. And if you know anyone who's unable to leave their residence, due to health conditions. We now have a link on our website that you can visit at www.gchd.us/vaccine scheduler/. Now, if you don't have access to the internet or it's just too hard to maneuver, you can still give us a call at our phone number, which is 810-344-4800. We're here to assist you.
Thank you, Sherelle. I appreciate that. And I also got a note that there is possibilities for people who are homebound that are not able to get out, that they can also call to have someone come to their home.
Yes, we are doing that and we have been doing that. So we encourage you to call us or visit that link and we'll get someone out to your home and get you vaccinated.
Thank you so much, Sherelle. So nobody in our community can go without. We heard that Hamilton Community Health Network is out there making these available. And of course, Genesee County Health Department and their other partners who are also ensuring that that opportunity is available to you. So please, those of you that are listening, let's share it with our community members. Dr. Reynolds. So glad that you're with us today, a retired pediatrician. And I just heard you earlier say you had something to tell us about children. So please come. I know you're ready to share that information.
And I'm only repeating what others have said, but it's important. Nationwide, 14.2% of the cases have involved children, the cases of COVID-19. So please, don't say that COVID doesn't happen to children. And this is why we must continue to mask up for the unvaccinated, especially those 12 and under who are not eligible for vaccines. Now, in the state of Michigan, and this is data from the American Academy of Pediatrics that was collected as of 6/24/21, 16.5% of the total cases in Michigan were cases of children with COVID-19. And so understand there are 2,407,690 children in the state of Michigan. And it's our responsibility as adults and teenagers to protect our younger residents in the state of Michigan. So this is not something that we can play with. And as far as the myocarditis goes, Dr. Hackert covered it very well, but if you missed it, if you have within 2 to 2 weeks after vaccination, you experience chest pain, palpitations, you feel like your heart's fluttering, you should get checked out, okay? But this is rare. The chances of you getting myocarditis, as Dr. Hackert said, from COVID-19 disease is far greater than the chances of getting myocarditis from the vaccine. So if we've given, over 150 million vaccines, and we have, as of the latest record, somewhere around 150 to 350 cases of myocarditis reported. Get that in your head. We're talking about 350 possible cases possibly related to the vaccine after over 150 million vaccines. So there's an expression that an anesthesiologist friend of mine said, when you're in the desert surrounded by snakes, you kill the snake closest to you. You don't worry about the snake that's a mile away. And the way we kill that COVID-19 snake is we get vaccinated, we maintain our physical distancing, we wash our hands and do those layers of protection. But remember, vaccination is the essential component to protect us.
Thank you so much, Dr. Reynolds. Don't go away yet. because there's a lot of misinformation, and so we appreciate you sharing that data, because there's a lot of misinformation that's been shared, a significant amount of distrust for issues that have happened over the years. So you're
I'm going to let the
sharing.
dog out and I'll be right back.
Uh-oh. All right. Well, then while you let the dog out, let me just say the sharing that happens here in the webinar, is one of the participants has said, is extremely important, because it is not always clear how the information is shared, when the information is shared, I should say, and how we will utilize that information. So our goal here is for those of you that are listening to us, is to please listen carefully so that you can make an informed decision. There are people who cannot get the vaccine for a number of reasons. It's the same as the flu vaccine. There are issues that occur that prohibit people from getting the vaccine. But for those of us, when you look at the information carefully, you examine it so that you can make an informed decision, then you're also going to be helping someone else. It is so incredibly important that we're in a position to make those informed decisions. So Dr. Reynolds, I just wanted to come back to you, because as we're talking about all of this information, we've not forgotten that we're still in the midst of following up on the issues related to the water crisis. And I know that, and you mentioned it before, I don't know if you're going to be involved in a conversation next week that I think is really, really critical. And you've talked to us about it before. And I just want you to if you would, just re-emphasize the importance of people having good information, particularly as it relates to the questions they're asked in preparation for some of the lawsuit settlement.
Oh, yes. And this is my opinion based on what I know about this thing that they're calling a bone scan, which is using industrial equipment used to detect lead in the paint on your wall, in the soil around you, or in other products where there should not be lead. And it is not intended, and the manufacturer has said this repeatedly, it is not intended for use on human beings. And it is clear that the research physicist modified this equipment without the approval, did you hear me say it? Without the approval of the manufacturer.
You did say that.
And also, the people who performed this, they call it a test or a service on people in a lawyer's office, did not inform them that this equipment was not approved for use by the manufacturer. So that's a violation there. And it is rogue research. And what I say rogue research, in our Flint community and across the nation, there are processes and procedures that assure that a research project is ethical, safe, and they monitor it, and they have the researchers make corrections if a problem is identified. That did not happen in this lawyer's office. And my concern is the testing was done, giving people the impression that if it's positive, they'll get more money. It's not always clear who's going to pay for it, because the consent says if my lawyer doesn't pay for it, I will pay the $500 myself. And it's really a money grab. I'll just say it the way it is, because the more tests that this lawyer and his researcher report as positive, the more money that lawyer gets, as well as some of his clients. And when they give you the report, they have no threshold which says, oh, it's definitely there. And they have no range so they can tell you this is so much worse than another level. And it got to the point where New York University School of Medicine told the researcher and the medical director, stop putting their logo on the report. And Harvard University is saying they can't find any record of approving any research for this research physicist. So what's happening is it's a flim-flam. Sounds promising, but it's too good to be true, and it doesn't change anything that we're supposed to do. We still have to eat well. Those mitigating factors, you've heard that word before. Eat well, plenty of calcium, iron, vitamin D. Yes, vitamin D again. Okay. Make sure our house, our water, our plumbing are free of lead. Watch the hobbies that we have that will expose us to lead. These are important things that we have to do. And then if your child has a problem in school, we need to request an evaluation by the school so that that child can get those services. If you see a delay, that child needs early on services, which are provided by all the school districts and even in the charter schools. So please, please don't be fooled. This so-called bone scan is not using approved, FDA approved equipment. It is not part of a standard diagnostic process. It's just unconscionable. And I'll be in court July 13th.
Thank you, Dr. Reynolds, for standing up, because it was based on your objection that this was brought to the light. And so we really want to just be sure that our community members have information so they can make informed decision. Please ask questions, because your questions are the voices that will make a difference. And so thank you so much, Dr. Reynolds, for sharing that. And we will be considering what you're doing next week and keeping you lifted, because the voices that will speak next week, everybody can't go to those hearings, everybody can't testify, but we certainly appreciate you and those who have the opportunity to speak on behalf of our community. So thank you. We're going to go Dr. Deborah Verholden. Dr. Deborah Verholden, who is on all of these task forces and does a lot of work, not only here in our community, but across actually across the nation. Dr. Deborah, it's a lot going on. Can you help us?
There's a lot going on in it.
There's a lot going on.
The good thing is things are going in the right direction, as my other colleagues have shared. And so the good news is cases are down. I always give people the caveat on percentages. So I'll just give you the numbers. 10 cases in Genesee County, 2 cases in Flint last week. So, you know, this is good news. And again, to echo what my colleagues have said, you know, the vaccine has been a game changer for us. It's adding a very critical layer of protection for many people. And you can see we still have a ways to go. So while I was on the call, because I have some college students in my house and some other things, I do encourage people. You know, the best thing that people can do at this time is get their vaccine and encourage others to get their vaccine, and then go on the myshot2win.com website, myshotTowin.com, because you do have to actually register for the sweepstakes. So right now, we're short of our goal of getting at least 70%, which is the national goal that was set by President Biden. We're short on that goal. We're 51.5%. So I just encourage everybody, continue to honor the protocols and get your shot, and encourage others to get your shot. If you just look at the next slide, you'll see the trends moving in the right direction. All of this, everybody who's on this webinar should be getting their weekly health equity brief. It's more than just information about, you know, the rates in the community. There's also some really good nuggets of information to answer some critical questions that people have about what do the variants mean? And will I still be protected? You know, things like that. But this just shows things are moving in the right direction. And it appears as though we continue to do a good job of keeping that racial disparities gap in COVID cases close. Last thing I want to say before I hand it over to my colleague, you know, we like to put things in context. So if you look, you know, we have 28 municipalities in Genesee County. You know, people always sort of give Flint a bad rap. Flint is not, you know, we try to produce the numbers so people can see it by rate. Flint is almost smack in the middle of all the municipalities. We ranked 13 this week in our COVID cases. So, you know, we're doing the work. I ask people to keep doing the work, get that vaccine. Continue to honor the protocols. And I love what Dr. Hackett says. Remember that even if you're covered, there are people around you who are not, especially our children. And this notion of you only have to mask up if you're unvaccinated. No one will ever know if you're vaccinated. People don't have to disclose that personal information. So just be mindful as you're around others who may not have the opportunity to get vaccinated to continue to offer that protection. And know that in Flint, we're doing really good. I'm gonna hand it over to my colleague.
So before you hand it off, Dr. Deborah, can I just ask you one quick question, because you talk about
Sure.
equity. Can you give us a sense of where we are looking at this from that equity lens? Because at one point we had the highest number of African Americans who died. How are we doing in that area? Can you shed a little light on that for us?
Yeah, it's a great question. And so this is the great thing about being a data person. So if you look at it, all the data together, you'll see in Flint, the disparity that we saw is pretty much gone. But where the story really unpacks is if you look at what happened over time. So when we started off, African Americans were much more likely to be COVID cases and to die from COVID. And what happened, so imagine that difference is like this. And what happened over time is that difference kept getting smaller and smaller and smaller until eventually what we saw is that we had eliminated that. Now, I've heard people say things, well, does that mean that whites got sicker? No, it didn't mean that whites got sicker. What it means is that all of the things that we knew that were needed to protect people, like people having the ability to shelter in place, everybody having access to testing in the community, putting those things in place and making sure that everybody was able to access that without any barriers, without needing a prescription, without having to travel really far. That gave us a better capacity for populations that were more vulnerable to get their needs met. So we are doing tremendous in the equity realm. And it's more than just the cases and the death. We're also talking about equity and resources. So we've got many initiatives, and I hope Yvonne will talk about these in the weeks to come, because there's a lot of COVID dollars out here in community. And I think we did a pretty good job of getting that money into the hands of grassroots community organizations who really are working with our most vulnerable residents and people most at risk on the ground floor. So the total picture, we're good.
Thank you. Thank you so much. All right. Thank you. Mary Catherine.
Okay, so I will just go ahead and talk about one of the more crucial pieces of the policy this week, since we are out of time. So let me just dive in by saying that because it's the start of July, I want to talk about a really important piece of policy that is going to sunset at the end of this month. So the federal freeze on most evictions is set to expire on the 31st of July. I want to point out that Michigan received $622 million of federal funding for rental assistance, and so far has spent $282 million. So we're really asking legislators to swiftly allocate the remaining $340 million in relief funds to keep Michigan renters in their homes when this moratorium expires. That is definitely going to be the most important of the three pieces of policy that we were going to talk about today. And the reason why this is so important, what I want people to know, is that because these are taxpayer dollars that will go back to the federal government if they aren't used. And it's actually required that they are spent or at least committed by September. So again, this is a conversation we need to be having to make sure renters are protected, and that our legislators protect taxpayers by keeping them housed.
Well, thank you, Mary Catherine. Appreciate that so much. And all of us know that this is an opportunity for us to continue to use our voice to make a difference. Please, we encourage our community health workers to continue to apply for those continuing education units, as well as our social workers to apply for those social work credits. Please check that correct box for your opportunity, and we will be sure that the process is followed for you. We encourage you to continue to like us on Facebook, Subscribe to our YouTube channel at Healthy Flint, and please email us any questions that you might have at info@hfrcc.org. Give us a call if you have any questions at 810-835-2130. And we have some great information coming for you next week, continuing to talk about the mandates, releasing, and what is expected in our hospital systems. You really want to get this information because it will impact all of us. So again, we thank you for joining us today, and we look forward to you joining us next week for the Flint Community Webinar on coronavirus. Thank you so much.